Hi, Dr. Gary Frenette here. And as you recall, you've already seen, I believe, the first chemotherapy video which we would recommend, and that's a general chemotherapy video. In that video, we talk about some of the commonalities that all treatments share and how you can anticipate and react to some of the potential issues you might face. However, as we mentioned, there's about 75 different medicines that we call chemotherapy. And we now wanted to produce a video speaking to you about the specific medications you'll be taking. In this video, we're going to discuss several issues with regard to that treatment. How do those drugs work? How are those treatments administered? What is the schedule of treatments? And we'll go into some of the potential reactions you could have to that treatment and how you can adjust to them. As always, whenever you have any questions, you should call your healthcare team if there's ever an issue. But by watching these videos, you may be better able to anticipate and prepare for some of the rare side effects that can happen. So as you can see here, we're actually within a chemotherapy treatment room. And we have chemotherapy chairs where you can sit and even lie back. There's TVs and internet access so that you can be entertained. And we'll also allow you to have a family member with you or a friend with you during your treatment. The specific number of treatments and the regulations, such as how old they need to be, will be discussed with you with your healthcare team during your chemotherapy teaching session. These videos, for example, are meant to supplement but not to replace that specific interaction you're going to have with us prior to your treatment, so you'll be able to get all your questions answered. During this video, what we'd recommend, as with the first video, is that you write down any questions you might have about your treatment, and then we can discuss those specifically when you come for your appointment to make your appointment more productive and to make sure all your questions have been appropriately addressed. There are some issues that you might imagine come about when you're getting chemotherapy treatment that I'd just like to discuss briefly. And as you can tell, we're in a large chemotherapy treatment room. That's done on purpose so that the nurses can have visual access to you during your treatment. If there are any unfortunate reactions or problems that you're having, we can recognize those immediately. Because it is an open space though, we usually ask that patients refrain from wearing heavy perfumes or colognes. Although you may not be bothered by them, other people may be more sensitive to smells during that treatment and therefore would appreciate you wearing as little perfume or cologne as possible. Likewise, oftentimes patients will bring snacks or food into the chemotherapy treatment room, which is completely reasonable and appropriate. But we'd ask that they not be especially strong smelling because, once again, some people can develop an aversion to strongly smelling food during their treatment. And so as a courtesy to others, we would ask that you try to respect that during your treatment. In addition to the TV, for example, or computers, a lot of times people like to listen to music or other audible entertainment. Because other people may be trying to rest, it's always a nice idea to bring headphones or something like that into your treatment room so you can enjoy the music or the TV at the volume you like without having to worry about disturbing others. The next portion of the video is going to be a slide presentation of your specific chemotherapy treatment. Make sure you have a notepad with you and jot down any notes or questions you might have or that the slide presentation generates so that we can answer them during your in-person visit with us afterwards. This video represents the views of Dr. Gary Frenette and not any clinic or hospital system. It's designed to supplement but not replace the written and verbal information provided to you during your teaching sessions. It reviews common trivial side effects as well as rare but life-threatening complications of therapy. Today we're going to talk about the TAC chemotherapy regimen, and this consists of 3 drugs: taxotere, adriamycin, and Cytoxan chemotherapy. To best understand how these drugs work and why we've recommended them for you, we're going to need a brief refresher on biology. Don't worry, we're going to keep it simple. Remember, all living things are made of cells, and the blueprint for how a cell and our bodies are made is encoded in a molecule called deoxyribonucleic acid, otherwise known as DNA. Here's a brief video showing this process. So cancerous tumors are characterized by uncontrolled cell division. Both normal and cancerous cells divide by going through something called the cell cycle. The cell cycle goes from the resting phase through active growing phases and then to mitosis, otherwise known as cell division. The ability of chemotherapy to kill cancer cells depends on its ability to halt cell division. When the cancer cells are unable to divide, they die. Chemotherapy kills cancer cells more effectively than normal cells because the cancer cells divide faster and cannot repair themselves in time. We'll show in this next video the cell cycle itself. So the scheduling of chemotherapy is set based on the type of cancer, the rate at which the cancer cells divide, and the time in the cell cycle at which a given drug is likely to be effective. This is why chemotherapy is typically given in cycles. Cycles are simply treatments which are separated by time intervals. During this time, the cancer cells die, while the normal cells have time to heal. When the healing of the normal cells is not complete, side effects occur. The normal cells commonly affected by chemotherapy include blood cells, the lining of the stomach and the colon, and hair follicles. This accounts for common side effects which include low blood counts, sores, nausea, and hair loss. Taxotere belongs to a group of drugs called plant alkaloids. Taxotere is also known as an antimicrotubule agent or a spindle fiber inhibitor. Spindle fiber inhibitors, such as Taxotere, inhibit microtubule structures within the cell. These microtubules are part of the cell's apparatus for dividing and replicating itself. These spindle fibers help separate duplicated DNA into each dividing cell. Taxotere inhibits this activity and thereby kills the dividing cancer cell. You'll look at spindle fibers in the next video. Adriamycin or doxorubicin is a drug which inserts itself between the DNA strands, thereby disrupting the double helix structure. Adriamycin also inhibits an enzyme called topoisomerase II, which is important in DNA replication. Inhibition of DNA replication in rapidly dividing or cancer cells leads therefore to cell death. Cyclophosphamide or Cytoxin is an alkylating agent that works by cross-linking DNA, not allowing it to duplicate. If the cancer cell cannot duplicate its DNA, it dies. Normal cells have higher amounts of an enzyme that renders the drug inactive, and therefore are less affected by the drug and are more able to repair any DNA damage done. Let's look at the TAC chemotherapy schedule. All three drugs are given by vein, that is intravenously or IV, every 21 days for 6 total treatments. Anti-nausea medications are given by vein prior to administration of the chemotherapy. The TAC regimen takes about 3 hours in the office to deliver. A steroid, dexamethasone or Decadron, is given the day prior to chemotherapy, the day of chemotherapy, and the day following chemotherapy. It helps to decrease fluid retention from Taxotere as well as allergic reactions. The dose is usually 8 milligrams twice a day. Growth factors such as Neupogen or Neulasta will be given under the skin subcutaneously to help your immune system recover more rapidly from your treatment. Here is a graph representation of your treatment. The day prior to your intravenous chemotherapy, you'll begin a 3-day course of Decadron, which you'll take twice a day. On the day of your chemotherapy, you'll come into the office and receive the TAC chemotherapy regimen, once again receiving intravenous anti-nausea medications just prior to the chemotherapy. The day after your treatment, you'll come in for a shot called Neulasta, which will be given under the skin, which will help your white cells recover more rapidly. This sequence is repeated every 21 days for up to 6 cycles of treatment. Let's talk now about some reactions that can occur while you're getting the chemotherapy, that is, infusion reactions. The infusion reactions are most common during the first 15 to 30 minutes of the Taxotere infusion. They can include flushing, shortness of breath, palpitations, or lightheadedness. Most reactions are quite mild, but very rarely they can be serious or life-threatening. For that reason, you'll be closely watched during the initial portion of your treatment. Infusion reactions are reduced by dexamethasone, which is a steroid, and other drugs such as antihistamines may be added when needed. Now let's talk about some side effects that can occur after you've completed your chemotherapy in the office. The most important thing to remember is that each person's reaction to chemotherapy is different. Some people may have very few side effects, while others may experience more. The side effects described here won't affect everyone who has TAC chemotherapy. Some effects include heartburn. This often feels like a pit in the stomach or even nausea and can be treated with medications, especially those that block acid formation into the stomach. Constipation or diarrhea can occur. Diarrhea is a little more common with this regimen. That can be treated by eating soluble fiber, the BRAT diet, that is bananas, rice, applesauce, and toast, or antidiarrheal medications. Adriamycin can rarely cause decreases in heart function or the pumping of the heart. Your heart function will be measured prior to starting therapy to ensure your risk is minimal. Muscle pain or headaches can occur either with Taxotere or Neulasta. These can usually be treated with over-the-counter pain medications, but once in a while you may require something stronger. Bladder irritation can occur with Cytoxan, but usually at higher doses than those given in this treatment. Good fluid intake after chemotherapy should help reduce this. Hair loss will occur about 2 to 3 weeks after initiation of this treatment. Loss of hair on the head occurs first, but eyebrows, eyelashes, or pubic hair can be lost as treatment proceeds. Your hair will grow back at a normal rate after treatment, but may at first have a different color or texture. The cost of your wig may be covered by insurance. Nail changes can occur with Taxotere. There are conflicting data regarding placing fingers in ice during treatment to help alleviate this issue. Maintain good nail hygiene and avoid false nails. Gloves may also help protect nails during work or during sleep. Mouth sores, as well as nasal tenderness, can occur and can be usually minimized with mouth rinses or non-alcoholic mouthwashes. Blood counts, and especially those white cells that help you fight infection, can be reduced with the regimen. It usually occurs about 5 to 7 days after the treatment is given. You should report any fever more than 100.5 or a shaking chill to your healthcare team. You will be given shots, as we've mentioned, to help promote recovery of your immune system. Nausea is usually mild with this regimen and occurs somewhere between 6 and 48 hours after treatment. You'll be given anti-nausea medications by vein prior to treatment and by mouth afterwards as needed. Remember that TAC chemotherapy can affect your fertility. Talk to your healthcare team if this is an issue for you. During chemotherapy, you should practice adequate contraception. Numbness of the hands and feet can occur secondary to the effect of docetaxel or Taxotere on nerves. This is known as peripheral neuropathy. You may also notice that you have some difficulty with fine motor movements, such as buttoning shirts or putting on earrings. It's important that you report these symptoms to us, as they may be controlled by slightly lowering the dose of your drug. This side effect usually improves slowly a few months after the treatment is finished. Lastly, doxorubicin is red, and as a result, your urine may become a pink-red color. This is normal and can last up to 48 hours after your treatment is completed. As we mentioned, you'll be receiving anti-nausea medications by vein prior to your chemotherapy. Remember, we'll also be giving you prescriptions to take home, and you can continue your anti-nausea medications by mouth at that time. If you experience nausea, don't hope it will pass and let it go away, but treat it immediately with these medications. Since they can cause constipation, you may need Miralax or another mild laxative along with them. The medications you may receive include Zofran or ondansetron. You should take 1 8 mg tablet every 8 hours as needed for nausea. This medication generally does not cause drowsiness, and therefore it's a good choice during the day. Phenergan or promethazine is taken once every 6 hours. It causes a variable amount of sedation, and therefore you should gauge your own reaction to this medication. Ativan or lorazepam is taken every 6 hours in addition, and this is probably the most sedating of the 3 drugs and can be a good choice at night prior to trying to go to sleep. Let's go over some frequently asked questions with this regimen that we can perhaps address. First, can I drive to my chemotherapy treatments? We'd like you to have a driver for your first treatment. If you receive drugs such as antihistamines that cause sedation, you may also need a driver for subsequent treatments. Will I gain weight with steroids such as dexamethasone? These drugs can cause fluid retention and increased appetite in some patients. Be aware of your food intake as well as the quality of the food you're eating. For example, avoid excessive desserts, salt, or simple carbohydrates. Can I get manicures, pedicures, massages?
Manicures and pedicures are usually avoided during aggressive chemotherapy. If you're receiving chemotherapy chronically, it may be possible to have manicures or pedicures, but you may want to bring your own tools and avoid cutting cuticles. Avoid heavy skin scrubs if you have skin sensitivity on the palms or soles. Massage therapy, however, is usually very helpful during treatment, but avoid deep tissue massages if your platelet counts are low. Remember, platelets are the cells in your blood that help your blood clot. Are there any food restrictions? Well, avoid uncooked fish, meat, or eggs. There are no restrictions regarding fresh fruit and vegetables. Simply wash them as you normally would before eating them. You may find you prefer cooler, lighter foods and meals during treatment. Smoothies, for example, with protein supplements, or Greek yogurt can be good, healthy choices. Can I exercise during chemotherapy? Absolutely, and we strongly recommend that you do so in order to maintain your strength and endurance during treatment. You should also pace yourself, especially on your slow days, and stop when you become fatigued. Should I change my diet to avoid cancer in the future? We'll discuss dietary changes, but you may find that only certain foods appeal to you during treatment or that your sense of taste has changed. Start slowly, therefore, with any dietary changes and focus on healthy, non-processed foods. Should I take anti-nausea medications at home after my treatment? Well, as we've mentioned before, we're going to prescribe those for you, and if you notice any nausea, you should definitely begin on those medications. Can I take my regular medications? Unless you're informed otherwise, continue your current medications as prescribed by your physicians. Should I take vitamins or supplements? There can be significant interactions between supplements or vitamins and chemotherapy drugs. Please therefore assemble a list of all your vitamins and supplements you're taking. In general, we really strongly prefer that these be stopped until after your chemotherapy is complete to avoid any unanticipated reactions. These can usually be safely resumed after your therapy is completed. Do I need a port or intravascular access device? Although we can often treat intravenously by simply inserting an IV catheter into the arm, ports are required for continuous infusion of drugs, poor or limited venous access, or when drugs are irritating the veins. We're going to show a brief video at the end of this summary, which provides an overview of ports for chemotherapy administration. So in summary, TAC chemotherapy is a very effective medicine because there is a therapeutic window. In other words, these chemotherapy drugs are specifically designed to be toxic to cancer cells, while your normal cells have the ability to recover from the treatment. The chemotherapy treatment and the supportive medications, such as, for example, the anti-nausea drugs and the shots to help your immune system, are delivered at specific times during each treatment or cycle. The side effects from chemotherapy are generally mild, self-limited, and managed with medications or behavioral changes. Severe side effects are very rare. Most importantly, if you ever have questions or concerns regarding your therapy or the symptoms you're experiencing, call your healthcare team. That is really what we're here for.
Well, I want to thank you for watching the second video today, and I hope you've written down all your questions so that we can address them during a personal visit with your healthcare team, what we call a chemotherapy teaching session prior to your therapy. That way, I'm very confident that you're going to be comfortable with your treatment and be able to anticipate any issues that arise. As always, however, if something unexpected happens, I want you to feel very free to call us at any time for any reason so that we can address any concerns you might have. My friend and colleague, Dr. Eric Wang, is now going to briefly discuss the use of venous access devices, or portacasts as we sometimes call them, in the use of chemotherapy. Not everyone who receives chemotherapy needs a portacath, but for example, those patients with poor access to veins in their arm, or patients who require continuous infusions of chemotherapy over 1 to 2 days, will be benefited by the use of these ports. With these ports, you can swim, you can shower, and perform other activities as he'll now discuss for you. So move ahead to the next section of the video if you think you may want to learn more about these devices, or if you believe you're a candidate for these.
Welcome. I'm Dr. Eric Wang, interventional radiologist with the vascular and interventional specialists of Charlotte Radiology. Your healthcare provider has ordered a port placement for you. I'm here to review this procedure and to make you and your family members feel at ease. A port is a small device used to obtain safe and reliable access to administer IV medications, such as chemotherapy drugs or antibiotics, and also used to obtain blood samples. Port is a small device, as I mentioned, and is about the width of a quarter and less than half an inch thick. The port is implanted underneath the skin surface at the chest, a few centimeters below the collarbone, and this tubing is then inserted into a neck vein. Most patients are relieved after they have had their port placed that they no longer have to be stuck multiple times in their arms to get IV access. The port, once healed, is relatively unnoticeable and requires very little care. Patients resume their normal daily activities. This can include taking baths, exercise, and even swimming without worrying about the port. During your port placement, you will be taken to an interventional radiology suite, where sophisticated X-ray equipment will be used for safe placement of your port. A technologist will then use special soap to wash the upper chest and neck, and then a sterile drape will be placed over the skin surface in order to provide a sterile environment to decrease the risk of infection. Once you are prepped, the nurse will give you sedation through an IV, and I will give you local numbing medication at the skin access site. A small pocket is created at the upper chest level, and then a catheter is placed under lifetime X-ray guidance into a neck vein. Once the port is placed, the pocket will be closed in a couple layers of absorbable suture, which will heal on its own. You will then go to the nursing recovery area and rest for about an hour prior to going home. Thank you for allowing Charlotte Radiology to be your healthcare provider. Please do not hesitate to ask additional questions during your visit.